Hi, I'm Michael from Planet Naturopath. And in this video today we're going to talk about the Complete Thyroid Test. When you go to your doctor and you have a thyroid test, they only check for TSH. And often you're told your thyroid is normal. But TSH is thyroid stimulating hormone. So that means it's the brain telling the thyroid to make T4. And T4 needs to get converted to T3, which is the active thyroid hormone. So the theory is if checking TSH is all you need to check thyroid hormone. But often people can have low T4 and low T3, but normal TSH. You can also have high thyroid antibodies, which is your body's immune system attacking your own thyroid, and have normal TSH. So if this is detected by the doctors, normally they'll say, let's just wait and see what happens, which basically means let's just wait until your thyroid's broken, then we can give you thyroid medication. Thyroid is involved in so many different functions in the body, and so there's many symptoms of low thyroid, from weight gain, depression, anxiety, fatigue, feeling overwhelmed, feeling the cold, dry hair, dry skin, hair falling out, high cholesterol. There's a long list of symptoms because thyroid hormone is so important for so many functions. Let's have a look at some different thyroid tests and I'll show you what I mean. And then I'll talk to you at the end about ordering the Complete Thyroid Test. Here is an example of the Complete Thyroid Test. So the doctors only check TSH and the reference range is 0.5 to 5, but the optimal range is between 1 and 2. So if your TSH comes back at 3 or 4, it's not going to get picked up as potentially low thyroid. But if you're looking at this example here, this person is exactly in the optimal range for TSH, yet their T4 and their T3 are subclinically low. So they're going to be experiencing low thyroid symptoms, but this is not going to get picked up by the standard doctor's test, which only looks at TSH. Reverse T3 is high, so this indicates possible adrenal dysfunction. So T4 is not getting converted to T3, it's getting converted to the inactive form of reverse T3. And their thyroid antibodies are low, so they don't have Hashimoto's, they have low thyroid, possibly caused by adrenal dysfunction. Here's another example of normal TSH, 1.5, once again perfect, normal T4, but T4 is not getting very well converted to T3. And if you look at the antibodies here, this person had undiagnosed Hashimoto's. So sometimes this goes on for years before they get diagnosed, but now we can see the body's attacking its own self. And if we start reducing down the inflammation and the autoimmune condition and supporting thyroid function, we can actually reverse this autoimmune condition before it becomes a situation where you have to rely on medication. Here's an example of someone taking medication. So when you take the standard thyroid medication, that is T4. So you can see their TSH is very low. Their T4 is high, which can be normal when you're taking thyroid medication, but it's not getting converted to the active form of T3. So even though they're on thyroid medication, they're still having trouble with weight loss, fatigue, mood changes, because they're basically low thyroid. So someone like this, you need to look at why they're low thyroid and why they're not converting T4 to T3. It could be from gut function, could be nutrient deficiencies. And their reverse T3 is very high again, so it's also possibly adrenal dysfunction. So this is an overview of how the thyroid works and how it interacts with adrenal function. So the brain releases TSH, which is thyroid stimulating hormone, and the thyroid makes T4, which is like a storage form of the hormone. And then in different tissues throughout the body, T4 gets converted to the active form of T3. But if the body is under stress from too much cortisol, it's going to inhibit this T4 to T3, and you're going to start producing more of this inactive T3. And reverse T3 has a function in the body that helps to sort of slow down the body when it's in a state of stress. But these days people are in a constant state of stress, so they're just not getting well. So we actually need to reduce down the cortisol reduce down the stress to help the T4 to T3 conversion. And when I mean stress, there's a whole different range of stresses, from psychological, traumatic, electromagnetic, infections, gut dysfunction, and even chemicals in the environment. So here's another example of a very low TSH. This person was also on thyroid medication, and so their T4 is very high, but once again, they're not converting it to T3 because the underlying cause has not been addressed. And this is where looking at things like iron, zinc, selenium, tyrosine, the B vitamins, vitamin D, they're all important for T4, T3 conversion. So here's someone with what's called the classical low thyroid symptoms. But even though their TSH is 3, most doctors are not going to see that as much of a problem. If you're only checking TSH, it's still within the reference range. It may not be in that optimal 1 to 2 range. But look at their T4 and T3, they're very low. So this person is just not producing enough thyroid hormone. And this is a case where if you did get this picked up by a doctor, they would say, yes, you do have low thyroid, because finally the TSH is out of the range. It's over that magical 5 number. And you'll see once again T4 and T3 is low. This person's going to be experiencing all the classic low thyroid symptoms. At Planet Naturopath, we specialize in digestion and hormone problems, and we can help you with the Complete Thyroid Test. When you go to the doctor and you just get TSH tested, you're not getting the full picture. It's important to do the Complete Thyroid Test to get an understanding of what's happening with your thyroid. Also, adrenal function testing is often important because the symptoms of low thyroid can be very similar to adrenal dysfunction. If you have any questions, you can email me at tests@planetnaturopath.com.